flagship land-grant research university is at the intersection of discovery, teaching, and research. And part of all of that is our commitment to deliver the very best of care to our patients and to share with others how we can best improve the care we deliver. These synergies are built around mission points that create invaluable opportunities that we're taking advantage of today. People are at the heart of our work. Service is the soul of this university. Our work challenges us to address the questions that confront all of us and think of the questions we haven't even asked. Today, we are addressing one of those complex questions with the support of federal, state, private, and institutional partners, as well as experts from a diverse array of disciplines on the University of Kentucky campus. The question we confront: how do we improve outcomes for patients transitioning between hospitals, clinics, their homes, and nursing homes? Too often, these transitions lead to worsening symptoms, adverse effects from medications, unaddressed test results, failed follow-up testing, and excess rehospitalization and ER visits. This morning, I'm proud to announce that the University of Kentucky is a recipient of a $14.9 million contract from the Patient-Centered Outcomes Research Institute, which will help us confront this important question. The contract will support Project Achieve, which combines the expertise of patients, caregivers, and stakeholders with national leaders in transition research. Our goal is to determine through evidence-based research the most effective methods for improving outcomes for patients in these transitions. What a collaborative team we have put together. Experts in statistics, implementation science, and quality improvement from 14 organizations, including the University of Kentucky, University of Pennsylvania, Boston Medical Center, Telegen, which is a quality improvement organization, Westat, and Kaiser Permanente. These are giants in this area. Leading this research is Dr. Mark Williams, Principal Investigator for Project Achieve, Director of the UK Center for Health Services Research, as well as Professor and Vice Chair of Internal Medicine. I want to congratulate Mark and thank him and his entire team for this achievement. I'd like everyone to join me in a round of applause. It is great for UK, more so to the citizens that we serve in the Commonwealth. This is not our first partnership with the Patient-Centered Outcomes Research Institute. Dr. Deborah Moser from nursing received a contract from this organization in 2013 to advance her research in interventions for cardiovascular disease in Appalachia. The incredible faculty and staff at the University of Kentucky are guided by our work with and for communities. We are called upon to be more than the University of Kentucky. We must be the University for Kentucky, in constant service to our people and to our Commonwealth. Thank you again, Mark, and your team.
Thank you, Dr. Capilouto. Next, we have the pleasure of having a very special guest with us at this announcement. She serves as Secretary for the Kentucky Cabinet for Health and Family Services, Audrey Haynes. Secretary Haynes.
Shall I speak from here?
Yes, please.
Great. Well, good morning, and thank you all so much for having me. This is so exciting. I first want to congratulate Dr. Capilouto, Dr. Karff, and Dr. Williams, as well as the entire university community on being selected. I think what Dr. Capilouto, you did not mention is how competitive this award was. you probably sensed that, right? The amount of competition. So the word on the street in the research community and at the federal level was truly how competitive this award was. And so really our hats off and kudos to the university. There is very little doubt that Kentucky's healthcare delivery infrastructure has gone through tremendous transformation already since November of 2011. Governor Beshear fondly says, we've been through healthcare reform in Kentucky with a capital R. And I think that is so true. We began in November of 2011 with the implementation of managed care within our Medicaid community, along with many other changes since then. We are creating already in Kentucky a healthcare delivery system with more accountability, with increased focus on prevention and early detection, with decreased use of high-cost emergency rooms for non-medical emergencies. And we are actually treating and managing here in Kentucky both physical health and mental health outcomes of our Medicaid consumers, all by treating the whole person. In May of 2013, the governor announced more access to health care for Kentuckians through, of course, the Medicaid expansion. We created our state-based exchange that we are really, really proud of, that we call Connect, and the addition of several new benefits available to Kentuckians through the Affordable Care Act, such as substance use treatment and increased behavioral health care. Not only does poor health have devastating consequences for Kentuckians, but it drains the finances of our state. It increases the need for services, and it diminishes our ability to recruit and retain high-quality business. For Kentucky to improve our competitiveness, we must address our health with the same vigor that we have addressed education. As states move toward value-based purchasing in healthcare, the importance of continuity of care and care transitions continue to increase, not only to promote better patient outcomes, but to reduce unnecessary expenditures. As part of that effort, our cabinet is considering a number of strategies to incentivize health service delivery as we all look to adopt more evidence-based practices. Through Connect and Medicaid expansion, hundreds of thousands of Kentuckians who were previously uninsured now have access to health care, 521,000 to be exact. So greater access continues to be a first step. The next step in helping to curb our dismal health rankings, though, is this really important step of looking at appropriate care, transition of care, continuing to have a decline on readmissions, and really creating a robust continuum of care for patients in our state. And we have a long way to go, but I could not be more excited because this fits in perfectly to everything we should be doing for our citizens all across the state. So thank you, congratulations, and thanks for having me.
Thank you.
Thank you. Secretary Haynes, thanks for joining us this morning. Dr. Mark Williams is Director of the Center for Health Services Research and Professor and Vice Chair of the Department of Internal Medicine here at the University of Kentucky, and we are happy to have him on our faculty. Dr. Williams established the first hospitalist program at a public hospital in 1998 and built two of the largest academic hospitalist programs in the United States at Emory University from 1998 through 2007, and then for the 6 years after that at Northwestern University. A past president of the Society of Hospital Medicine and the founding editor of the Journal of Hospital Medicine, he actively promotes the role of hospitalists as leaders in delivery of health care to hospitalized patients. Notably, he also serves as principal investigator for SHM's Project Boost, and Boost stands for Better Outcomes by Optimizing optimizing safe transitions. With more than 100 peer-reviewed publications, including in journals such as the Journal of the American Medical Association, the New England Journal of Medicine, and Annals of Internal Medicine, Dr. Williams' research focuses on quality improvement, care transition, teamwork, and the role of health literacy in the delivery of health care. Dr. Williams.
Thank you. And first I want to thank Dr. Karp from the University of Kentucky for the opportunity to come here hardly just 9 months ago to be able to work with an incredible team here. This team allowed us to put together this proposal, which competed actually only against 21 others initially, in a few places such as Yale and
21.
Harvard and Michigan and Vanderbilt, and University of California, San Francisco, and so forth. And it has been a tremendous honor to have this opportunity to utilize resources that aren't available in other places in the U.S. We have incredible researchers in the College of Public Health, College of Communication Information, College of Arts and Sciences, College of Medicine, that allowed us to put together what I felt was a unique team to collaborate with institutions and experts around the nation. Basically, the leaders of the major care transition programs in the United States decided to come together to pursue this PCORI award because all of us wanted to improve care for patients. And I noticed comment President Capilouto made that these patients are the heart of our work, and it's why I'm here. And I've been taking care of patients in emergency rooms and in hospitals for more than 25 years now. And too often, patients are leaving the hospital, and then they have to go to their homes or to other facilities, and there's a big gap in care. And we haven't figured out really how to help bridge them and get them the care they deserve. And that is essentially what we're trying to do in Project Achieve. Talk to patients, find out what outcomes matter most to them, find out what processes we can provide them to help them transition from the hospital to nursing homes, to their homes, between clinics and nursing homes and their homes. And also to work with their caregivers, because the family and their caregivers are integral and essential to deliver care to patients and optimize their care delivery. And that's another critical component of this. So Project Achieve is first going to interview patients and their caregivers to find out what they need to achieve a successful transition. We will then also begin to look at large data sets using CMS data, Quality Improvement Organization data, to look at what has happened to patients as they've been transitioning, look at the impact of the various transitions of care initiatives across the United States to see what interventions seem to work best. And then we'll conduct a very large prospective study interviewing literally 10 patients and looking at over 40 hospitals across the United States. We're also collaborating with organizations such as Joint Commission Resources, America's Essential Hospitals, and the American Hospital Association with something called Hospital Engagement Networks to look at interventions they have been attempting to identify those components of transitional care interventions that seem to work the best, and then figure out which ones work most effectively together to come up with a toolkit to help hospitals and health systems deliver optimal patient care transitions. And then we're going to be working very closely with PCORI and CMS now as we begin to develop this eventual toolkit to optimize patient care transitions.
Very good.
Thanks.
Thank you so much, Dr. Williams. Our next speaker is the University of Kentucky's Executive Vice President of Health Affairs, Dr. Michael Karp. Dr. Karp.
Thank you. As Dr. Capilouto pointed out, we are the university for Kentucky, not the University of Kentucky. I think that's a very important distinction. And 11 years ago at UK Healthcare, we tried to understand what we needed to do to serve the citizens of the Commonwealth well. At that point in time, we recognized that we needed to focus very heavily on building advanced subspecialty programs, the kind of things that a Vanderbilt does, or Mayo Clinic does, or a Cleveland Clinic does, or Massachusetts General Hospital does. So those kind of procedures would be available in Kentucky. And I think we've made great strides in being able to accomplish that goal. We also said we needed to start building partnerships with other providers around Kentucky to develop a system that would bring care to patients' local communities whenever possible and for the most extent possible. We've also, over the last several years, recognized that as Kentucky and the rest of the country embark on this journey called healthcare reform, that the systems and approaches of delivering care and keeping people healthy after we've gotten them healthy are going to change over time. And I think it's important to make sure that Kentuckians have access to the very best changes in healthcare reform, that Kentuckians benefit from the way healthcare gets delivered in the future as opposed to how it's delivered now. In order to do that, we felt we needed to develop a program in health services research. And as Dr. Williams pointed out, we recruited him 9 months ago. In 9 months, he's had an extraordinary impact on this institution. And I think that the only way that we can assure Kentuckians that we will evolve our healthcare system in an effective manner that focuses on value is by helping the nation figure out how to change its healthcare system. And this is what this grant represents. This represents the University of Kentucky taking a leadership position in health services research that will help the whole country, not just Kentucky, understand about transitions of care, and will help us get into other issues in terms of not only the science of healthcare, but the actual delivery models of healthcare that are important to patients, important to their families, that will bring better outcomes and be much more effective. So, it reminds me of when Dr. Evers said we're going to go for cancer center designation in 3 years, and I thought he couldn't do it. He proved me wrong. When Mark said he was going to go up for this grant, and I know a lot of the folks in those 21 institutions that we competed with, and they're very powerful researchers, said, Mark, don't be too disappointed. It's worth the try, but just don't be too disappointed. Said, hey, nothing ventured, nothing gained. I never thought we'd get this grant, but it's really a credit to Mark and his ability to bring significant researchers from around the country together. A focused effort that will help Kentucky, but will also help the rest of the nation. I congratulate you, Mark, and the team that you assemble. It's really special for us to be able to participate at this level.
Thanks, Dr. Karp. Very well stated. At this time, we'll open it up for any questions. We do have a couple of news media representatives in the room. Anybody have any questions for Dr. Capilouto, Dr. Karp, Dr. Williams, or Secretary Haynes? Karen.
For Dr. Williams. I think it was you who mentioned that the purpose of this is going to help patients who might end up with worsening symptoms. How do you think this will help, or how do you anticipate this will help patients as far as potentially having a quicker recovery time for those patients?
So I think a key aspect is when patients are transitioning, say, from the hospital to home, sure there's pristine, literally, communication at multiple steps there. There's the communication at the time of discharge from the healthcare team to the patient and their caregivers. And then when they leave and go home, there's continued communication to find out how they're doing in the first 24 to 48 hours. They should know who they can call if issues arise so that they can connect back to their outpatient provider. And so there also needs to be communication between the hospital team and the outpatient provider. And just as collaboration was essential for the success of this grant, you have to have terrific collaboration as we care for patients and their families, honestly, as they're moving through our healthcare system. And a major goal of this grant is to show how that collaboration can occur in the context of where patients live, their community. And I think this is a key aspect that we're going to focus on, is the importance of the community in delivering care to patients as they're moving among healthcare sites. One thing we cannot forget, most healthcare actually occurs in the home where people live. And we basically contact them as we take care of them in the hospital if their health deteriorates, or when they're seen in an outpatient clinic, or if they need to stay in a rehab hospital. But most care is going to be in the home. We've got to figure out how do we transition patients to that setting and support them while they're there.
So in the past it was not intentional, but sometimes things just got lost in the shuffle or in translation.
Yeah, no, I think you have people that are highly educated, they're committed to caring for patients. Patients don't want to usually stay in the hospital or go to the emergency department, and neither do their caregivers. And there's a famous consultant, and he describes hospitals as the most complex systems in the world. And we literally need to figure out how to bring the sophistication that now exists in healthcare delivery to patients while also taking care of these very important, if you will, community support, social issues at the same time.
Thank you.
Any other questions? All right, if not, speakers will be happy to visit with you on a one-on-one basis. We thank you all for your attendance, and again, congratulations, Dr. Williams, and congratulations, the University for Kentucky. Thanks.